okay.
Well, good afternoon, and thanks to all of you for joining us today, and happy almost spring. Today we have some updates on how the vaccine rollout is going and what that means as we move forward. A year ago this week, we had our first known case of COVID and our first known death. And it has been a tough year for everyone. But we're now in what we hope is the final phase of this pandemic, and the future really does look hopeful. We're often up here delivering bad news, but today let's start with some good news. Our cases are going down, and our vaccinations are going up. We've achieved the aggressive goal we set back in January. Back then, as you remember, just a few weeks ago, our goal was to get to 25,000 shots a day, and we accomplished that. We set our long-term goal to get everyone vaccinated by this summer would be 50,000 shots a day, and we have achieved that. We're now averaging almost 51,000 vaccine doses administered each day in our Commonwealth. We're 11th in the country in terms of doses given and 6% of doses used. In fact, on some days, we've administered more than 60 or 70,000 shots a day. 18% of our Virginia's population has had at least one dose. That's 1.5 million Virginians, and remember, we have about 8.5 million Virginians. We had a very good week last week vaccinating Virginians, and we're going to keep getting those numbers up. Some of our health districts have done so well at vaccinating a majority of those 65 and older that they're able to increase vaccination for other groups eligible under Category 1B, such as people under 65 with pre-existing conditions. A great example is the three far southwest Virginia health districts, Mount Rogers, Cumberland Plateau, and Lenawisco. They started increasing their vaccinations of people with health conditions at the beginning of this month. Our health districts will keep vaccinating anyone who is older than 65. This is good news. It's forward progress, and we're going to keep it up. Next week, we'll start phasing in a handful of community vaccine clinics that we're setting up with assistance from FEMA. You've seen massive clinics on TV, like at Dodger Stadium. Well, Virginia won't be that big, but these are intended to be large-scale events, able to vaccinate anywhere from several hundred to several thousand people in a day. We're working to identify sites that will help us vaccinate people equitably. We're starting with sites in Danville, Petersburg, and Portsmouth. We're scheduling for these clinics and the other vaccination events run by health departments in part from the pre-registration list. We launched a website and call center a few weeks ago and urged every Virginian to please sign up. Now we're reminding Virginians that you should go into that pre-registration system and make sure that all of your information is filled out and up to date. This is important so that we can make sure we have the information we need to know when to call you for an appointment, especially if you're over 65 and haven't been vaccinated yet. Make sure we have your age, your address, and the correct contact information. Now, what I'm getting ready to say is very important. It is important that you answer your phone. Our call center and local health districts are telling us that a lot of people aren't. And I think we're all guilty of that because of numerous reasons. And I know that everybody, including myself, is tired of spam calls. And most of the time, as we usually say, it's not smart to answer if you don't know who's calling. But right now, until we get everybody vaccinated, please answer your phone. It's about getting your shot scheduled. All along, we've said that vaccines are the key to getting our lives back to normal. This week, the CDC affirmed that, saying that people who are fully vaccinated can safely spend time inside with other fully vaccinated people. That's good news. This is just very hopeful and optimistic news. It's a small step forward, but it's an important one. That's why we all need to get vaccinated as soon as we're able to. This is literally our path back to normal. So is going to school. Last week, President Biden announced that the White House wants states to prioritize vaccinating teachers as well as child care workers. Luckily, here in Virginia, we said back in January that teachers are essential workers, and we have been vaccinating them ever since. Our school divisions report that 2/3 of staff have received at least one dose of the vaccine, and nearly 40% of staff are fully vaccinated. We are continuing to prioritize vaccinating teachers and school staff, and we're encouraging the pharmacies in the Federal Pharmacy Partnership to prioritize teachers as well. While vaccinating teachers isn't essential to offering in-person learning, it certainly helps that effort. We've got more data and science now than we did 6 months ago, and we know that there are ways for schools to hold in-person classes safely. In January, we provided guidance to our schools about how to handle a return to the classroom. And in early February, I said we wanted to see all of Virginia's school divisions ready to offer some level of in-person learning by March the 15th. When I said that, around 30 school divisions were still fully virtual. That's about 1/3 of our school divisions, responsible for about 500,000 students. I'm glad to say that now all of our school divisions have submitted plans for in-person learning options, and most have started. Now more facilities have more options, and this is really good news too. The CDC has also issued federal guidance for schools. Our Department of Education and Department of Health have worked closely together throughout the pandemic to make sure our schools have what they need to make the best choices for their students and their staff. And now they're updating our guidance to schools so divisions understand how they can remain open safely and continue bringing students back this spring. We know this is important to our children's education and also to their well-being. Our children have endured a lot of change and uncertainty in this past year. They have been our champions, but we know it is taking a toll. We're seeing a decline in academic performance, and we're seeing increased behavioral problems and mental health issues. So I'm glad that our children are getting back into the classroom because that is where they need to be. Pam and I have visited several schools over the past couple of weeks, and we've seen the difference this is making. The enthusiasm is real, and I want to thank everyone who is working so hard. And I know that all of you can't go and visit our schools, but just take my word. When I go into these classrooms and I see the excitement from our teachers, the excitement from these children that are sitting in their desks with their mask on, they're keeping their distance, they're playing by the rules, they are just so happy. And I've heard it from a lot of them, just to be back in school with their friends and their teachers. And so I just want to reiterate to families out there that if you're concerned, and I understand your concerns about your children being back in the classroom, it is one of the safest places to be, and I encourage all of you to be open-minded and work with your teachers, work with your principals, your schools, and do everything that we can to get our children back in the classroom. This past Sunday, March the 7th, marked the first known COVID case in Virginia at Fort Belvoir up in Northern Virginia. And this coming Sunday, March the 14th, will mark the first known COVID death in our Commonwealth. None of us knew what was coming. Tragically, in the past year, we have lost more than 9,000 Virginians to this disease, leaving behind families, friends, and neighbors to mourn loved ones lost too soon. Many Virginians have suffered other losses, lost jobs, lost income, a loss of security, and of knowing what will happen next. It has been a hard year for everyone, but I have been so encouraged by your resilience and strength. We have seen such generosity this past year. You've stepped up and done your part to keep your neighbors and our community safe and healthy. On behalf of the Commonwealth, I say thank you. I especially want to take this opportunity to thank our frontline health workers, our first responders, and law enforcement, our health departments, and everyone who has worked so hard this year to help people. The vaccines are a light at the end of a long tunnel, and that light gets brighter every day. For now, we need to keep doing the things that we know work. Wash your hands, wear your mask, keep your distance. But there is every reason to be hopeful that things are getting better for all of us. So hang in there. We're going to put this pandemic in the rearview mirror. I'll be glad to take questions. Andre, it's good to see you.
Good to see you, Governor. How are you doing today?
I'm fine, thank you.
Governor, I got a couple questions, if you will. Virginia ranks 12th in weddings, and a lot of Virginians who work in this industry are concerned. They don't understand your restrictions, saying because of these restrictions, they can only have a certain amount, 25 people, whereas concerts can have up to 1,000. Also on sidebar, the high school folks want to see their loved ones participate in athletics who've been training for years to showcase their talents, and they think that they can, attend these venues that are outside, space themselves out, and even the cheerleaders can space themselves out as well. And then lastly, boxing has been classified as entertainment. So those in the boxing venue don't understand that, and their restrictions are limited as well. Thank you.
Let's talk about the weddings first, and certainly encourage folks to marry. I've happily married for 35 years, as you may know. The numbers, as I said, Andre, the cases are going down, the positivity rates going down, vaccinations are going up. We made an announcement at the end of February that would cover March, and we're looking at the numbers every day. And what we hope is that if these trends continue, that we'll be able to ease or lift some of the measures that we have put in place. But I would just, I guess, ask you or ask anybody to think about what happens at weddings. And if you think about what happens, people are in close proximity. They're hugging folks. They're glad to see. It's a happy occasion. There's eating, there's drinking, there's dancing, there's singing, all of the things that we know that spread this virus. And so, we've really tried to follow the science and follow the data. And as soon as we can, I promise you, we'll lift the measures. But it's just not safe right now. Yesterday was the first day in many weeks that we had less than 1,000 new cases, and that's all good news. But we need to continue to follow these trends to make sure the numbers are down in communities so that it doesn't recur and we don't end up right where we were before. So again, we'll ease the measures as soon as we can. Now, yes.
I did talk to some of them about that, the things that happen at a wedding, and they want an opportunity to, again, restrict themselves to stop some of that contact and prove that they can do this safely.
Yeah, I hear you. It's difficult to control, and I know their intentions are good, but just as you have, I've been to a number of weddings, and again, I won't reiterate what I just said. As far as outdoor events, high school football, as you know, they're playing ball now. We want people to go out and be able to be spectators and see their children and be with their friends. We have increased the number of individuals at outdoor stadiums to 250. That's through March. And again, if these numbers continue, if the trends continue to be favorable, we'll make further modifications that will start on April 1st. So I would say more to come in that regard. And then your last question, maybe we can talk about that a little bit, was boxing. Just run that by me one more time.
Those who are in the boxing industry said that they've been classified as entertainment, thus their capacity is restricted as well.
Yeah, I'm not sure why boxing is a sport, but I would look in that. I may be able to get back to you on that particular issue.
Whitney Evans, VPM.
Hi, Governor. Thanks for taking my question. Can you speak to the latest involving the controversy with the Parole Board and the Office of Inspector General? Can you help clarify for us what role your office and the Office of the Attorney General had in the release of that first OIG report, and what are we doing moving forward to ensure transparency?
Yes, thank you for that. The question is regarding the Parole Board, and a couple of comments I would make. Number one, I support parole. I believe in second chances. I believe that it is a very important part of criminal justice reform. Number two, the last thing that I'm going to let happen as this evolves is for it to become politicized. That is not in anybody's best interest, certainly not in the parole boards or the Office of Inspector General. And thirdly, I have said, and I will continue to support an independent investigation. We are having discussions with the Attorney General, with our legislators, and the plan to have an independent investigation to get to the bottom of all this is ongoing, and there'll be more to announce in that regard. I do want to remind folks that the Office of the Inspector General reports to my Chief of Staff, Clark Mercer. He's with us today, and I'd ask him to make a few more comments regarding the upcoming investigation and what's been going on with Officer of Inspector General and the Parole Board. Clark, thank you.
Thank you, Governor. And again, Clark Mercer, the Governor's Chief of Staff, and I think this is an incredibly important issue, frankly, with a lot of unsubstantiated accusations being bandied about and a lot of politics being played, and we need to level set and set the record straight. And I will begin by talking about the importance of inspectors general. And prior to my position with Governor Northam, I worked with the Department of Defense in both Iraq and Afghanistan, looking at waste, fraud, and abuse in our wartime contracts. And in that role, worked alongside of Inspector Generals for the Defense Department, for USAID, for the State Department, and for both Iraq and Afghanistan reconstruction. So I have some career track records with inspectors generals and respect and understand the critical role that they play. We have 70 some odd agency heads in the Commonwealth of Virginia that report up through me, including the Inspector General. It is a standard operating procedure. We have had hundreds of reports and investigations and fraud hotline calls that have been made to the Inspector General over the course of this administration. And I meet quarterly with the Inspector General and review his reports and recommendations for how we can improve and move government forward. Most of those reports, I will tell you, don't rise to the level of discussing at a press conference. Snowplow contracts for VDOT, how individuals in financial aid offices are awarding tuition. But almost to a report, the company line is for secretaries and agency heads to accept the findings and recommendations of our Inspector General and implement those recommendations to improve state government. So that's very important that we meet often, as we should, and secretaries with the Inspector General and his staff. The topic of the parole decision of Vincent Martin is one that warrants discussion because it is one of, if not the most high-profile parole decisions in the history of the Commonwealth. It was a brave and bold decision both by the Parole Board and the Governor, and one that we stand by strongly. There have been individuals that have been very loud and very critical of parole in general. They don't support parole, perhaps in the most extremely limited circumstances. And in this particular case, they have been very loud in their opposition to the parole decision of Mr. Martin. So, last summer, when a 6-page report was delivered to my office, the first time we saw any such report or findings about the process to parole Mr. Martin, and I underscore the word process. The Inspector General looked at the steps that were taken after the policy decision was made to parole Mr. Martin, not to look into that policy decision, which I note several of the legislators who have weighed in from the other side of the aisle opposed, but it was the process, notification. Did a Commonwealth attorney get the proper notification? That not what he thought about the parole, but the notification that parole was happening. And the Secretary and I would certainly agree that there is confusion in the General Assembly, in the public, and at OSIG's office over how the parole process works. And we have supported legislation which clarifies that and improves that process, and that legislation is sitting before the governor now, and I would assume he would take action on it very soon. So last summer when we got this report, it wasn't your typical report. It was a high-profile report. I asked Secretary Moran, what does your team think about OSIG's report on the parole process for Mr. Martin? And the response was, we are very critical of it. We think it is highly biased. We think it omits sections of code that are very relevant to the process to parole him. It points to some sections of code that are incorrect. And there's substantial commentary on the kind of individual that Mr. Martin is that has nothing to do with the parole process that they were supposed to look at. And in his parole packet, there were substantial write-ups on Mr. Martin's behavior while incarcerated that were omitted if we're talking about writing about the kind of person that Mr. Martin is. So Mr. Martin, who was eligible for parole starting in 1994, was paroled last summer, and this report came out, or last year, and this report came out. So I did what anyone would do. I called the Inspector General and said, I'd like your team to come over and discuss with our team your findings. We have some questions. We have some concerns that the report, 6-page report, is not particularly accurate, and we would like to hear from you. That team came in. There was about 4 folks from the Inspector General's office that came in, 4 individuals from our office that met. We went into that meeting thinking that there was bias and there was lack of objectivity. We left that meeting knowing that there was bias and a lack of objectivity in that report. It has gone unreported on since last year, or very minimal reporting, but the parole board itself came out with a point-by-point rebuttal to that 6-page report, pointing out chapter and verse why they had concerns with OSIG's findings, why they did not think those were accurate. And while that may be mundane and very detailed-based, it is fact-based, and we need to deal with facts when it comes to this case. So fast forward to yesterday, apparently there is a lawsuit that has been dropped by an individual who is the primary author of this OSIG report. She's been put on leave by her employer, which involves an active state police investigation into leaks from draft reports out of OSIG's office. And those draft reports include unsubstantiated claims that are being bandied about as fact by political opponents. Incredibly irresponsible. The Inspector General is required by law, if he comes across any credible example of criminal activity, to pass that on to law enforcement, be that a Commonwealth attorney, be that a state police. The Inspector General has done no such thing. The governor has called for an investigation, an independent investigation. We have leaks starting last summer, including by members of the General Assembly, that violate the same code sections that the OSIG's report deals with. So we want that investigation to run the gamut, to look at how this report was put together, how a draft was made into a final draft, why unsubstantiated claims were not included for the public. I think it's obvious why, if something is unsubstantiated, they're not included in a final draft. That being said, we want it to be independent. We've begun to speak with legislative leaders. We have begun to speak with the Attorney General's office about what form that investigation may take. It may very well include outside counsel, which would necessitate a budget amendment, which obviously the governor would have the ability to make between now and reconvene session. But I will note yesterday, and folks talk about the politics of this, I was disappointed, and I think it does not take much work to connect the dots here, that the counsel that has been retained in this lawsuit is on the ballot himself in November, running for office. He has sued the governor several times this year alone over elections and over COVID. He has sued Senator Louise Lucas this year. He has sued Senator Mamie Locke this year. He has sued the Speaker of the House, Eileen Fillercorn, this year. He has sued both clerks, the clerk of the Senate and the clerk of the House. And he's also in a lawsuit with gubernatorial candidate Amanda Chase. Of all of the thousands and thousands of lawyers one might retain on this very, very serious issue, to retain an overtly political stakeholder is disappointing. We need serious people to look into this, and we need a serious outside investigation. Because at the end of the day, unsubstantiated claims, that's not my word, that's the Inspector General's job, is to substantiate claims, are being bandied about as truth. I would encourage, I have the Secretary available, as well as our Press Secretary, to walk you through the Parole Board's response to last summer's 6-page report. We stand by our assertion that it was biased, was not objective, and we need to get an independent group to come in here and take a look at it. And because of the fact that there's an active state police investigation into the illegal leaks, because now there's an active lawsuit, and because we have called on an independent investigation, that is going to be it for the commentary that we provide on this issue. And we will certainly provide an update soon when that independent investigation is further along. Thank you.
Question not on the Parole stuff, but on the vaccination, registration, prep mod, and VAMs, and kind of the issues there. Two things. One, can you get us up to speed on where we are with this workaround to help out the health districts with this? But also, was this a choice of a poor vendor? What was the issue here kind of going with this company or these companies?
Yes, thank you, Henry. I'm going to let Dr. Avula address that. Danny, thank you.
The question was clarification on the registration platforms we've used in VAMS and PrepMod, and was this a situation where we made the wrong choice with a vendor, and what's the path forward? So the first platform that we used, the VAMS platform, was what was issued by the CDC. The CDC, in conjunction with a consulting firm, developed VAMS. It was meant to be kind of the baseline platform that most of the country adopted. In the initial rollout of that in late December, early January, we recognized that there were some significant gaps that VAMS wasn't able to do in terms of the seamlessness of the registration process and the transfer of information to VIS. And so we made the decision to shift to a new vendor. PrepMod was a vendor that multiple states jumped onto. We had talked to other states about their initial experience. But similarly, when we actually put PrepMod into action, we identified ways that it was not ideally supporting the registration process. Two specific things. One, when a link was issued for somebody to register for an appointment through, that link could be shared with other people who could then also register for an appointment. Clearly not the intent of that individualized link, but an issue that wasn't able to be rectified by the vendor to date. We're still working with them on it. We hope that they will deliver a fix so that you have non-shareable links. The second issue was the issue of bulk uploading. So when we pull names out of our pre-registration system, we pull that into a file, and the ideal scenario would be we would take that whole file and bulk upload it into PrepMod, which would then send those links out. Again, the vendor has not been able to deliver on that to date. So we've had to figure out how do we work around that, and so our VDH team, the Office of Information Management, has built some solution that we're testing this week, and we're going to see how it merges with the current PrepMod process. Hopefully, it will really resolve some of these issues. So we'll have more to report on that next week. But clearly, it has not been an ideal situation with these two registration platforms, and we've heard that feedback clearly from our providers who are using this. We've been working every week to try to make it better, and I think we're pretty close.
Are there other options out there, or was it just limited selection and this is what you got?
No, I mean, as I've talked to colleagues in other states, the question was, are there other options out there? There have been a few other things that people have used. Some have used homegrown solutions. Some have contracted with different vendors. I would say that none is perfect. I mean, I'm on a weekly call with my counterparts from across the state. In fact, we were just on with a state earlier this week that was talking about their similar experience with PrepMod and asking us about both our pre-registration solutions and the workarounds we've developed with PrepMod. So I think this is a really consistent issue that many of our colleagues across the country are dealing with.
Jessica Jewell, WSLS.
Hi, Governor. Now that more people are getting vaccinated and the CDC is easing up on guidelines, what guidance do you have on allowing nursing homes and long-term care facilities to welcome back visitors? And if you don't think that's appropriate right now, what will it take for us to get to that point?
You want to address that?
So the question, if I can unstick myself here, as I understand the question is, given the length of or the extent of vaccination, can we change guidelines for skilled nursing facilities, assisted living facilities to allow visitation? We certainly can take that into consideration. We've been working for some time throughout this entire pandemic quite closely with our colleagues in the long-term care facilities, and I think that the issue there is not so much the ones who are still resident and the staff, but there's a lot of turnover in nursing homes. There's about each month something like 7,500 new residents who come in. So trying to maintain a high level of vaccination within those centers becomes a real issue, as well as ongoing containment issues like testing frequently and continuing to do isolation of anyone who is infected. So I think it's an issue that we'll have discussions with the administrations and management of nursing homes to see if we can come to some kind of conclusion whereby we can provide them with the resources they need to ensure the continued safety within the walls of their homes. And if that is the case, then I think we can then talk about loosening up the restrictions. It's sort of related to what the governor was saying in his opening remarks, that if everyone around you is vaccinated, then it's okay to return to sort of normal activity, even being unmasked, but in an indoor situation. But we have to sort of ensure that that's actually the case before we could change the guidelines.
Thank you, Dr. Howard. Just to follow up before we get to Laura, I'm asked every day, multiple times a day, when will we be able to return to normal? When we'll be able to take these masks off? And the answer to that really is, as a general statement, is when we reach herd immunity. And the reason that's so important, the virus needs hosts such as myself and all other individuals to survive. It also needs hosts to mutate, which it's doing right now. And so this is why it's so important to continue the guidelines that we're following, the wearing the mask, to keep the social distancing, and to get as many people as we can vaccinated. Once we get to that herd immunity, the virus will not be able to survive in our environment and will be behind us. And so the answer to a lot of the questions, when we'll be able to go back to normal, it's when we reach herd immunity and when this virus has nowhere to live and it will go away. Laura. Hi.
The law firm investigating VMI put out an interim report last night. I'm wondering if you have any reaction to that. Apparently they found some instances of racial slurs and sexual harassment, and then it also reported that some board members thought the investigation was redundant. So do you have any reaction to that?
Yes, thank you for that. The question was about VMI and the interim report, which came out yesterday, and I have reviewed that, Laura, and I think a lot of the findings, while they're preliminary, are very disturbing. And so the investigation needs to continue. It needs to continue unencumbered. And I urge the folks at VMI to cooperate and allow the firm that we have retained to do an open and independent investigation. And at the end of the day, what we want for VMI and what we want for any college or university in Virginia is for that place to be open, to be welcoming, and for people to feel comfortable when they go to school there, and for their families to feel comfortable, and for the staff, the faculty, et cetera. So that's really our goal. Again, this was an interim report. We'll have a final report probably in June, July timeframe, and we'll look at that, and along with recommendations and work with the Board of Visitors and the superintendent, again, to make VMI welcoming and make sure that people are comfortable on the campus there.
With the Virginian Pilot.
Hi, Governor. Is your expectation that more school districts will begin full-time instruction by the end of the school year?
The question is, will more school districts have full in-class learning by the end of the school year? Again, it's a great question. It's not a one-size-fits-all. We've talked about this, I think, on several different occasions. We have allowed the schools, the districts, to look at the data in their neighborhoods and make the determination on how they move forward with in-class learning. Again, we certainly recommend and encourage families to be comfortable with sending their children to school, but we also realize that there are situations with families, perhaps they have elderly individuals living at home, people with special medical needs, and they're just not comfortable with their kids returning to school. And so we understand that, and the schools will continue to provide virtual learning. Again, as I said earlier, until we get to the point where this pandemic is finally in the rearview mirror. So while we encourage our children to be back in school, we understand that that's not going to be the case for all families, and the schools will work with these families, and the localities will make these decisions. Hey, Dr. Lane, welcome.
Thank you. I'll just add to that, Governor. We release a map on our website that's a snapshot of what the modality of opening is in every school division. We update that on a frequent basis, and it was updated recently this week as of yesterday. And we've seen a significant number of our schools moving towards more in-person opening as we approach March 15th. There are many school divisions that have gone from hybrid, which was, say, a 2-day-a-week, that are now later this month going to 4 days a week. As the governor mentioned, we had a few dozen schools that were predominantly remote. As of today, I think we're actually under 12 as of today, and by March 15th, certainly we'll have all but maybe 1 or 2 school divisions that have their in-person starting, and I think the last school division will start with their in-person learning on April 12th, which is immediately after spring break. And so in the media, I saw some reports that maybe Sussex did not have a plan. I just want to clarify that every school division has a plan, including Sussex, and we're looking forward to working with each of those school divisions on their plans. Thank you.
Yeah, I was hoping you could speak more to the community vaccination clinic that you said would be opening up, I think, last week. I'm wondering specifically, how were the 3 sites you mentioned chosen? Who will be eligible for vaccination at those sites, and how will they be configured in terms of walk-in, drive-through, what have you?
Curtis, you want to? Sure. Yeah, it's Curtis Brown, who directs our emergency management, is going to address that. Thanks, Curtis.
Thank you, sir. Thank you, Governor. The sites were selected through an assessment of all the local governments. We were looking for large sites that were accessible to the public. We had an equity analysis to look at how close they were to vulnerable population, and we were able to drill that down to 5 different areas. This first 3 jurisdictions will be the first 3. We will be adding more over the next 2 or 3 weeks after this first group comes, excuse me, after this first 3 comes out. So this is just the first 3 out of hopefully up to 13 that we'll have over the next 3-month period. And so this first group is Petersburg, Portsmouth, Danville. These are only individuals who register. So the registration component is still important. We do not request folks to just drive up to these sites. We're using the registration to do that. This is a part of the $179 million of FEMA funding that we received, and we're going to leverage that for 13 sites. We're using a contractor solution for these. We will stand up some additional state-supported sites using the National Guard as well as the Medical Reserve Corps and others in the weeks ahead. So we'll keep you updated where these sites are. Virginia State University and Petersburg and Portsmouth will let you know where that site is as well.
Will they be open, will they be considered closed pods in the sense that people will be called to learn if they're eligible and can go for appointments at these sites?
Correct. They should not just drive up. We're using a registration system. We'll continue to assess the data on a weekly basis. At some point, when we move to a different phase of the response, we'll open it up a little bit more, but right now, it's only through those who register. Thanks.
Next, we'll go to Luann Rife with the Roanoke Times.
Good afternoon, Governor. I'm trying to step ahead to a few weeks when supplies might be better than the demand for the doses. And the goal then will be to try and educate and talk to people who are reluctant to get the vaccine. And I'm just wondering, the pilot had reported over the weekend about the death of a woman who died shortly after being vaccinated. And so I'm wondering, how is the state reporting adverse reactions or possible investigations so that people can look and understand and evaluate what they perceive as risk?
Yes, thank you. It's I think two questions. I'm going to have 2 individuals address those. The first is our supply, and Dr. Avula is going to talk about the supply and what we can expect over the next few weeks and months. And then I think the second question was related to the individual that passed away after receiving a vaccine, and you can address that and looking at side effects. Dr. Avula?
So to the question of supply, we are this next week, we're anticipating about 188,000 first doses, about between 160 and 170,000 second doses, and that's of Moderna and Pfizer. We don't yet have our allocation, although we expect it to be significantly less than last week of the Johnson & Johnson. The federal government has said that the next 2 weeks we should anticipate not really getting much in the way of Johnson & Johnson until the week of March 29th, where I think Virginia's allocation will be north of 100,000 doses just of Johnson & Johnson. So that will really be the time where our access and our supply really increases. It'll be the time where not only are we fueling these continued large mass events, but hospitals are getting more and more, private providers and pharmacies will also be getting more and more. So I think all of that puts us on a trajectory to really be able to meet the demand for the 1B group by the 2nd or 3rd week of April, and really meet what the president said last week, is that all Americans will be able to get vaccinated, at least with their first dose, by the end of May. And I would say we're probably going to be a little bit ahead of that schedule in Virginia for everybody who wants to get vaccinated. You're right, Luann, that does mean that our focus needs to simultaneously be on vaccine hesitancy, and there's a couple of strategies that we that will continue to employ to get there. One, private providers have a really important role in that. The trusted relationship that doctors and other providers have with their patients will help people get off the fence, and that's really important. This first phase hasn't focused on that community just because there's been so much demand, and so we've really been focused on how do we meet that demand. But increasingly, we will need the expertise and trust and relationship that providers have with their patients to help move more people to make that decision. The second is the actual methods we employ to get out into communities, right? We know just looking at our data that we're not reaching Black and Latino residents to the degree that we want to and need to. And so the more that we do community-facing events, the more that we get out into neighborhoods where many undocumented residents live and do those types of open vaccination events, the more that we're going to be able to educate and support and ultimately provide opportunities for vaccination to address some of that hesitancy that might exist. The last thing I'll say is that it's been really interesting to watch the national data around hesitancy. 2 months ago, I probably said here that we have a lot of concern about the African American community and their willingness to take vaccine. That's changed dramatically. From December to January to February, we've really seen vaccine hesitancy drop in that population, and where we see the most hesitancy is actually in white Republicans living in rural areas. And so we are going to have to continually shift our education, our messaging, and our strategies to get vaccine into those hesitant communities.
The second question was regarding how do people in the community find out about adverse events from vaccines. There is at the CDC, which you can access online, something called the Vaccine Adverse Effects Reporting System, or VAERS. This is a reporting system through which anyone anywhere in the country can report what they consider to be an adverse reaction to having received the vaccine. And it compiles these reports every single day. Being in the VAERS does not mean, therefore, that what is reported is actually related to the vaccine. It's a self-report from either an individual who had the reaction or someone who observed the reaction in that individual. But it does provide the CDC then a way of then proceeding to have an investigation into that reaction to see whether or not it was, in fact, connected to the administration of the vaccine. So that would be the best way for people to do that and see, get a picture of what types of reactions are being reported to the CDC.
The parole board, the lawsuit that you mentioned claims the governor's staff intimidated the agency of the whistleblower. So is there a response to that from the governor's office and a message for the families who are now living in communities where these paroled individuals are?
Yeah, I appreciate the question. We've made a statement on that, and as we said earlier, this is pending or ongoing litigation, and I'm not going to have any further comment. This is why we need an independent investigation to come in and answer those very questions. Thank you.
Julie LaRue with the Suffolk News Herald.
Hi, Governor. Thank you for taking my question. With the variants of COVID-19, and as we're seeing in Virginia, how much genomic sequencing is being done, by the state labs to determine the presence or spreading of the variants in Virginia, and what's our capability of doing that?
Yeah, I think the question was what our labs are doing with the genomic. Yeah.
Thank you for that question. So regarding the variants that we've seen around the world and across the country and now in Virginia, the so-called UK variant and South African variants, we've identified cases here in Virginia. There's no evidence that these particular variants cause more serious disease, but we do know that they are more infectious and transmissible. And so we want to get an idea of what the actual spread of those variants are in the Commonwealth. The state's lab is carrying out genomic analyses of tests to help out on this, and we have partnered with a couple of other academic institutions in the state to do that, and we are in the process of using funding that we've received from CDC to expand that capability so that we can get a really good idea of how widespread these variants are in the state. Modeling that has been done on these variants shows that the UK variant in particular could become the dominant variant in the Commonwealth within the next month. And this underscores the importance of what we've been saying here about getting the vaccine when it's your turn and it's available to you. We're in a race to get everyone vaccinated before we run up against some variant that is one that is either resistant or more deadly. So I really encourage people to get vaccinated as soon as you can.
And Governor, maybe for Dr. Avila, we're continuing to get complaints from people up to as late as this week that their information isn't showing up on the state pre-registration system despite saying they had registered with their local department. Can you explain why that might be? Is there still that data transfer going on, or what's happening?
Yeah, the question is that that CAM continues to receive complaints from residents who can't find themselves in the pre-registration system. And I would say, you know, there are a number of reasons for that, and what we would want anybody who can't find themselves to do is to call the 1-877-VACCINE-VA number, and an agent will help try to reconcile. All of the merging at this point has been done. Most of the data cleaning has also been done. There are a few scenarios where someone didn't provide, you know, either a full name or a birth date, and then those weren't able to be matched to an earlier record, which is why there was an email that went out to everybody in the system earlier this week that says, we need you to update your information. And the updating of that information is important for a couple of reasons. One, because once you fill out the rest of those fields, we can complete the merging based on the first name, last name, and date of birth. But also because you know, you can log in there either a change of your employment status, like perhaps you, at the time that you registered, you didn't fall into a 1B qualifying category and now you do, or also the ability to mark if you've actually been vaccinated or not. It's important that everybody does that. It's really valuable information to us to know who we should keep calling and pursuing to get vaccinated. But also in the event that, you know, a year down the road we need a booster around this, we would have that database to tap into. So we really encourage everybody to go in there and go ahead and update their information. And if you have gotten your vaccine, when we pull down the list, we'll be able to sort out the folks who have been vaccinated so they'll stop getting called.
Circling back to that OSIG report, I know you mentioned regarding those allegations of intimidation or interrogation here in that meeting, but also any response to the allegations that the AG's office had a hand in scrubbing that larger report from 13 down to 6?
Cam, again, I appreciate the question, but that's why we need the investigation. I've encouraged that, and we're making plans to move forward with that. I want to thank all of you for being with us again. I know we've gone on a little bit in time, and I wanted to address one issue. We're obviously working toward herd immunity. That's the key here. That's why we want as many people as we can to be vaccinated. We have about 8.5 million Virginians. We have 3 very effective and safe vaccinations now, the Pfizer, the Moderna, and the J&J. Now, what about our children? The only vaccination that's been approved for those that are 16 and above is Pfizer. Moderna is 18. So that leaves a lot of children that still have yet to be vaccinated. And so there are ongoing trials looking at the safety and efficacy of these vaccinations, and those won't be completed until the fall or winter of 2021. So the message here is that it's going to take a while to reach herd immunity in order to get both our adults and children vaccinated, which is what our ultimate goal is. So our message is get vaccinated when you can. That's very important. and also continue to follow the guidelines. The combination of the vaccinations and following our guidelines, the social distancing, the hand washing, and the wearing of facial protection is the way that we'll put this pandemic behind us. But it is going to take some time, so be patient and we'll get there. Thank you all. And Henry, any announcements on when the next press conference is? I promise to do better, but thank you all and have a good afternoon.